Good evening. I'm VJ Narayan, and this is Straight Talk, a special Straight Talk tonight. And we're talking to three people who have been in the field of medicine and dealing with a number of patients, dealing with a number of medical issues. You may be familiar with some of them who have come out in recent days to talk about vaccination and other issues. So we give you this opportunity to meet them in person, virtually, and also hear their side of the story on Straight Talk. We have tonight Dr. Lisi Tikonduandua. Thank you very much, Dr. Lisi, for making yourself available this evening for our listeners and users. We have Fiji Medical Association President, Dr. Bashar Munshi. Dr. Munshi, thank you very much for making yourself available, knowing your busy schedule. And Dr. Penwell Emmy, who recently did a video on vaccines and trying to debunk some of the issues that were being raised on social media. Dr. Emmy, I know you've got a lot of meetings, a hectic schedule, even into weekends. So thank you very much for making yourself available this evening. Getting straight into it, firstly, for the benefit of our listeners and viewers, starting with Dr. Lisi, can you please talk about your work in the medical field, when you started, and the operations you have been involved in?
Oh, thank you, Vijay. I am now retired, but I worked in the Ministry of Health from the 1970s, 75. I worked for more than 40 years before I retired. Most of the time I worked in pediatrics and child health. And child health is not only curative hospital care, but a big part of it is preventative. So, you know, preventative medicine means vaccines, breastfeeding, nutrition, making sure that the child grows up healthy to an adult life, to be able to compete on the same level as everybody else. That was our main objective, right? So, yes. And, 40 years, I'm thinking back, when I worked in the beginning, in the 1970s, children in Fiji, there was, you know, that we collect data. Part of a very important part of our work is collecting data, weekly, monthly, quarterly, annually, on everything, every disease. And the communicable disease, the infectious disease is a very big part of the job that I did, or my team in pediatrics or child health. And we were a very small part of medicine until, well, child health was just considered a special part of the internal medicine until 1990, 1989, 1990, when we became one of the major disciplines in health. Pediatrics became a big department. So for us, the infectious diseases was what was killing our children. Right? So that is why vaccine, to me, is like a very important subject to me, and something that I totally believe in, because it made a big difference in the health and the mortality of our children. So our infant mortality dropped when we started to use more vaccines. The time when I came into medicine, we only had vaccine for tuberculosis and the diphtheria, tetanus, and what was the other one? Whooping cough and polio. It just started. So since then, we have added many more. So now the children of Fiji, in the first year of life, they are protected against at least 13 or 12. The 13th comes in when they're in primary school. That's for the protection for cervical cancer for girls. They have the injection in primary school so that the risk of getting cervical cancer when they're young, when they're women, childbearing and all that is.
Thank you, Dr. Lisi. Dr. Amy.
Thank you, VJ. I work in the adult version of Dr. Lisi's discipline. I work as a consultant physician in internal medicine, and that involves cardiovascular diseases, respiratory, neurological diseases, endocrine, and infectious diseases also. So we also do preventative medicine. We do clinical and preventative medicine in the adult medicine field that I actually work in. If I was to put it in layman's words, it would be I don't work as a surgeon in doing surgeries, look after children in pediatrics, and I don't do women's health. So I do everything else in terms of adult medicine outside of those fields. Thank you.
Thank you very much. That's a good explanation. Dr. Bashar.
Bula Vinaka Vijay and Bula Vinaka to all the listeners. Thank you very much for inviting me to be on this program. It's certainly an honor. My name is Dr. Bashar Munshi, and I am a general surgeon by profession. Currently, I am based at the Pacific Specialist Healthcare Hospital, where I am the clinical director, as well as the in-house general surgeon. I am looking at my two fellow colleagues who are here with us today, fair bit junior to them, and I have had the honor of having Dr. Lisi as my doctor and pediatrician when I was born, actually, incidentally. So yes, we go back that far. In fact, I'm pretty sure that at that point, she either vaccinated or helped supervise my vaccination. So thank you, Dr. Lisi, for that. So my field is has to do with the general surgery. It's to do with fairly broad top-to-toe surgery, including and not exclusive to the thyroid gland, chest surgery, skin and soft tissue, abdominal surgery, other forms of sort of bowel surgery, gallbladder, etc., as well as a big part of being a general surgeon is dealing with non-communicable diseases, complications such as diabetes and its complications of sepsis, food sepsis mainly, and other infections that it can cause. So I have been a surgeon. Well, I graduated and qualified in 2011, and I have had some further interest areas that I have studied in, especially trauma surgery, as well as a bit of colorectal surgery. So at the moment, with all behind me with all those experiences, I'm practicing out of the private sector.
Thank you, Dr. Basharat, and what an interesting conversation we'll have tonight. Even one of the doctors now whose doctor back in the day had even maybe administered a vaccine or two at the hospital. And we'll be talking about vaccines too later tonight. But let's talk about explaining to the people from your perspective, an analysis for the people how dangerous, and I call it the enemy. In this case, the enemy is COVID-19. At times, people are trying to attack the people who have unfortunately gotten this virus, but at the end of the day, the enemy is the virus itself, COVID-19. Now, can you tell me, first of all, Dr. Basharat, how can this be spread, COVID-19, and how can people get this?
Thank you very much, Vijay. So as we all know, and we have probably all, even the laymen, have been following this from day one. It all started sort of in the beginning of 2020, end of 2019, as a new virus, as a novel coronavirus. And initially it was in Wuhan, China, from where then it spread to the rest of the world. As with any other viruses, viruses are very small living particles. There's no specific treatment for viruses like bacteria. So if you get a bacterial infection, you give them antibiotics and patients get better. But unfortunately for viruses, there's no specific treatment. So how this virus, a particular virus spread, was through droplet contamination. And we've had this virus now in circulation for a year and a half, approximately, and a little bit more than that. So when a virus is this widely prevalent, it can mutate in certain populations, especially when it is spreading rapidly. And one of the things I should mention is, especially in the non-vaccinated populations, it can mutate. And that mutation can lead it to become a much stronger, much more infectious version of itself. Or sometimes the mutation might make it less infectious. In our case, at the moment, we have the Delta variant. That is the predominant form that we are facing at the moment. And this is a much more infectious version than the initial Alpha version that started it all off. So how does it spread? Well, it is a respiratory virus. So it spreads through, like if someone is infected and coughs and sneezes through droplets. And there is also now fairly good evidence, I guess, to suggest that it may almost be airborne as well. So due to the infectious nature of this Delta variant, you may just have to be a contact and not necessarily be coughed or sneezed upon for more than 15 minutes with a patient who has got corona, and you can get this virus. So it's very, very infectious, this Delta variant, much more so than the original version of itself. And it loves sort of closed spaces where people are congregating together, and it's a sitter in such settings to spread itself very, very quickly.
Thank you, Dr. Bashar. Dr. Emi, how can we prevent ourselves from getting COVID-19, and how important are these layers of protection?
Okay, we've had a lot of advocacy talks and programs on COVID protection itself, and we're constantly being reminded on the basic protocols, which is one, social distancing, more than 2 meters, because it has been found that in places where people are in contact for about 15 minutes without any masking, or just within the presence of an infected person, within 15 minutes, you can basically get the virus itself. So the basic protections and the COVID protocols that we're following is what is applicable now, which is masking, social distancing, 2 meters apart, and the latest one is the vaccinations. Just because, basically, to prevent, you have to take ownership of this disease by looking after yourself, protecting yourself, following the COVID protocols, and then getting vaccinated. So this is the best way, because in terms of getting vaccinated, your first vaccination reduces transmission by 50%, has been found out, and the second vaccination actually is higher. So these are the basic COVID protection protocols that we should follow.
Yeah, just Dr. Emi, why 2 meters? Why is the distance 2 meters?
This is the transmission capability of the virus itself. Within the space of 2 meters, it can basically make contact. And why this virus is particularly more transmissible than the alpha one? It's been found that it's about 30 to 70% transmissible, and it's got to do with the gene mutation within the virus itself, where it has a high affinity and ability to attach to the host cell. It can replicate very quickly and multiply within the host cell, and it can actually hide within the immune system of the host cell. And it's in that multiplication and rapid multiplication of the virus itself is the infectivity, where it basically starts shedding and people can actually catch it.
Now, if we do catch it, Dr. Lisi, your question, what would or could happen to us if we get COVID-19?
Well, you get sick. If you get the virus, is that what you're asking?
How sick can you get, and what is the different steps that comes in when you get COVID-19? For some people are asymptomatic, for others maybe more severe or even death. Can you explain that, please?
Okay, the important thing is to know the incubation. When you get a virus or germ, there's a certain period of time when that organism comes into the body before it, and it's doing everything that it can to multiply and all that, before the person will show symptoms of disease or feel sick. That is what we call the incubation period, like maybe a week, 2 weeks, for different diseases have different organisms will have different incubation periods in a host cell. So for this COVID-19, they say the incubation period can be up to a month. So people can be walking around with the virus and they don't even know that they are sick. And they can still transmit. The more this recent mutation, the new variant is very, very infectious. Because like, I think Bashar, you were explaining that, that especially in places where the vaccine coverage is low, these viruses mutate and they become a new variant. They become even more virulent. And as Amy has said, it just doesn't take that long to transmit this virus to another person. So people are potential carriers who we meet on the street. That's why we have to be very, very careful with the precautions that have been set out by WHO and of course by the government. Masking, masking up, covering your mouth and your face, keeping your distance, hand washing, not touching your face and all that, because this is how you get the diseases. But the point is, how many people would remember to do all that, especially hand washing? We'll put a mask, but hand washing, keeping your distance. This is a virus that we have seen, as Bas was saying. It's more than 1.5 years now. It's still raging. And TNTG. So I think the message is that any person we meet, we don't know their status. Any person you meet is a potential carrier infectious. That's why they have advised that we keep within our bubble. Do not go out unless it's absolutely necessary. Stay in your bubble, follow the precautions, the guidelines that they have put out, protocol for safe living, and vaccinate, please.
Thank you, Dr. Lisi. And because of staying in our bubbles, this is being done virtually via Zoom. So we'd like to thank the doctors again for taking out their time for this. Now, compliance, let's get into it, because non-compliance is a major issue at the moment of COVID-19 protocols. We've had reports even up to yesterday of positive people drinking grog with negative people in containment areas. We've had people calling us about people still moving around in groups, people from different households, people still sharing cigarettes, takis, etc. And even up to some businesses not following the 50% capacity, a real concern that on the ground things have been happening. Last night, the Prime Minister has announced new laws, new regulations, which sees fines, infringement notices to be issued for various things, including non-wearing of mask and not following physical distancing, businesses not following or complying to be taken to task. But the three doctors, you have seen things on the ground. I've given you feedback about what we are picking up and continue to pick up from many of our listeners and users. Dr. Amy, non-compliance in the community?
Big issue. It's a very big issue. It's a reality. And it stems out from the nature of who we are as Pacific Islanders. We're very sociable people. And sometimes to a stage of slackness, sorry if I have to use that word, we take things lightly, and the level of commitment, not necessarily the word commitment, but the level of adhering to caution and all that is being dished out in terms of protecting ourselves from this COVID is not taken seriously. And so in terms of compliance and following what is being meted out from government level, from the health level, from every sector of the government, is not being adhered to just because of, I can't say we're ignorant, because there's so much discussion about COVID itself in the media, but it's just sheer, it's not, oh gosh, what's the word for it? Well, okay, let's just say compliance is a big issue. It's not being, it is a general low compliance rate, and whether it's due to the socioeconomic status of people, they cannot afford certain protective things, or whether it's due to the messages not getting out into the community, or whether it's just due to sheer attitude of the people that are basically breaching and breaking protocols. You know, there are many factors that contribute to this, but one of the biggest thing is our social nature in this country, in the Pacific as a whole. And the fact that we're taking this lightly because we're not seeing the devastating effect until now, and you know, and just the general attitude that it can't happen to me. It can't happen to me. And we have a very young population in this country, you know, risk takers. They push the boundaries, and they basically don't listen. So we faced with a lot of factors that basically has given us this low compliance in terms of enacting the COVID protocols.
Thank you, Dr. Emmy. Dr. Lisi, when I was speaking to you about this show, you did say the concern for you was disobedience. Can you elaborate further on non-compliance?
Disobedience. Yeah, I agree with what Amy has mentioned, but everyone has seen the effect of this virus in the way we live our lives now. Even before the situation that's happening in Fiji now, we all read the news, we all listen to the news, we all hear the things that have happened in other places where there's lockdown, people are restricted from moving, they cannot gather together and congregate together like before. The churches are closed, every worship house is closed, all that. So we already know. Then when we just come here, because I don't know, I agree with what Amy has said. It's the usual thing of not taking things seriously. You know, we laugh it off and things like that in our natural way of living in Fiji. But this is serious. So there is a lot of disobedience. They are disobedient to the authority. I mean, did I hear you say that do the people really know that they're positive and they're going and sharing all that, or they don't know? They're two different things. because if people know that that they have something that's contagious, we have the Public Health Act, which can, you know, but they can apply to these people who break the law because you are not allowed to spread something like this. Yeah, that the people with infectious diseases cannot spread, be allowed to run around and spread the disease. Or I think more often people don't know that they have the virus. So they congregate and somebody in the group has the virus. So then it spreads. Like I was just saying, nobody knows who's got it. That's why we have to treat everybody as a potential carrier and keep your distance.
Thank you, Dr. Lisi. Dr. Bashar, the issue of non-compliance, a major concern.
Thank you, Vijay. I think Dr. Emmy said it correctly, that each and every person has to take ownership of the disease. I'm reminded of one of the past American presidents, the late John Ferdinand Kennedy. In 1961, his inauguration speech, he had said something to the effect, ask not what the country can do for you, but what you can do for your country. I think this statement actually rings really, really true in our current predicament of COVID-19. This disease is everyone's responsibility. It's not only the government or the doctors or the healthcare workers doing their usual job that'll curtail the spread of infections. It is each and every law-abiding citizen of this country doing the right thing that will help us curb this disease. It is still possible. I know the numbers are atrocious, and everyone is worried, including my two panelists and I, that things are out of control. But I think we can still reel it in if everyone takes responsibility. Now, the issue of non-compliance, I think there's multiple reasons and layers for this, and most of it has been mentioned. And one of the things, sadly, as human beings, I guess, unless something becomes personal, unless it affects you personally or someone you love, sometimes the message just does not register. I think we are getting to the point where we are seeing people or know of people that are close to us who have gotten the disease, who've had a severe outcome from the disease, or even have died from the disease. Recently, we've had a death of a dear colleague in the medical fraternity, which was really, really painful to us in the medical community. So that's as personal as it gets for us. I think, sadly, sometimes for some individuals, due to the human nature, unless it gets personal, then we are a bit reactive. So the strategies, I can see Dr. Fong was there from day one, empowering the public. He was, there were questions being asked. You're going to make mask wearing, social distancing mandatory, and if people don't follow these, are you going to fine them? The good Dr. Fong had, in his very well-natured way, said, look, I am trusting our own people to do the right thing. They should not be negatively punished for not doing the right thing, because it's the right thing to do. I think we tried that strategy for a while, and sadly, we can see that there are possibly downsides to that strategy when there are pockets of individuals who probably don't even believe in the disease, that the disease exists, or how the disease spreads, etc. So if you don't have acknowledged that the disease exists, if you don't acknowledge how it spreads or the means of preventing it, then it's very hard for you to comply with the measures that have been mentioned. So sadly, it has come to the point where we have to employ what is termed negative reinforcement strategy, so fines for people. Like, I mean, in Fiji, I can still remember when I was a child, seat belts were not compulsory and no one used to wear them. And when seatbelts were mandated by law and fines were imposed, pretty much 100% of people now wear seatbelts in the car. So sadly, it's come to that point where we've had to, where the government rather has taken that necessary step of imposing fines in order to deter people from non-COVID safe behavior. But I so wish, and if the people that are listening to our discussion today, please, it doesn't have to be a negative reinforcement. Please listen to the science that is out there. The information is all around you. Listen to the right forums. Sometimes it's boring, you know, unfortunately, washing your hands, wearing a mask, keeping 2 meters away, having your KFEG app on, getting the vaccine. It sounds a little bit non-glamorous and boring and very mundane and routine. However, these mundane, routine, boring things actually save lives. These are simple things you can do. So please do it. And to our younger people who may be listening, the teenagers and the young adults, we understand your frustrations. You are at that age where you want to go out into the community, socialize with your friends, play a game of rugby together, play soccer together. Unfortunately, now is not the right time. You may not get very sick with the disease. However, you can get the disease and spread it to your elderly parents, to your grandparents, and they can have a bad outcome. So I do encourage, even through the Ministry of Education portal, perhaps to try and encourage our young people to practice COVID safe behavior. And I am confident that with repeated messaging and now with the negative reinforcement laws coming in, we will hopefully begin to see better COVID safe behavior being practiced.
Thank you, Dr. Bashar. Now, going into things that have changed in the last few days, with the increasing number of cases, we're getting now almost every day more than 700 cases per day, and that's the confirmed swab results for people who are now going to the swabbing clinics, because the contact tracing in the swabbing strategy has changed now due to the increasing number of cases where people need to go to the swabbing clinic, and the health officials have to now just re-strategize based on the increasing numbers. Starting with Dr. Lisi, with the now swabbing only done at swabbing clinics, we already have health officials stretched. What are your thoughts on this, as it shows the health resources and frontliners are getting stretched on the ground?
Yeah, that is going to be one of the biggest issues there. I think the people really need to know that people who work in health in Fiji, the numbers are limited, and they are being, spread out over all the new places that they have formed, CMET, gymnasium, that place, that hall at Melot Street, all these places, and they need doctors, nurses, all these. They are not machines or robots. They are human beings that need rest, but they are working, leaving families and have not seen their families sometimes for a month. Because they work, they go off, they quarantine, have their test, come back again. Right? So that is bound to happen. We are not a well-off country. We are a low-income country. So we depend on a lot of aid from other countries to give us things that we need. We don't have enough money. Now, if they run out of swabs and all that, if they're asking people to go, that's because they don't have the people to go. Before they were going out to take swabs for contacts and all that. That is the difficulty that we are going to face, this nation. If we continue to go, if we don't make a change, if the people will not make a change, I am just hoping that with all the number of cases that have been reported in the last few days, that people are going for vaccine and, sort of sitting up and taking care of themselves. I really hope that that is what is happening. But Bashar has already said it. One of the medical officers, one of the doctors has passed away from COVID-19. What is it going to take when the health professionals are down and out? There's going to be a mess. I can just say that. We don't want to reach there, but that is the reality that we are facing if people will not comply with what is required to stop this virus from being transmitted and spreading. Now it's not only on VT level, it's gone to Vanua level, and then it's going to the other islands. I hate to think in the long term. Not really, Jay.
Dr. Bashar?
Yes, thank you, Dr. Lisi. Yes, I totally agree. I mean, as we have established, this Delta variant is something that is highly infectious. When we had an outbreak last year in, I believe it was March, April of last year, we had the Alpha variant, we had some non-compliant compliance as well, and we did not see anywhere near the number of cases that we are currently seeing. So this is a very infectious variant, and initially the strategy of Ministry of Health was screening and containment. When the numbers are low, then you do have the manpower to screen the contacts, be able to even isolate them, actually police that isolation, because you probably have the workforce or manpower required to do this. As you said, we are currently seeing in excess of 700 cases a day. One case may have, up to 8 to 10 contacts. Some people move around quite a bit. They may have 50 to 100 contacts. It's coming to a point, well, we are at that point, that we cannot contact trace anymore. There's too many exposures. So the strategy has to change now. The virus is widespread. The strategy has to change from containment to dealing with the sick consequences of the disease. So the so-called mitigation stage. So we are transitioning into the mitigation phase as we speak. And as Dr. Lisi has said, there are a number of things that have been set up. So so active contact tracing has stopped because we just don't have the manpower to do that. Instead, the health centers and fever clinics are set up now to deal with mild sort of cases. The FEMAT hospital, which was initially dealing with non-COVID cases, and CWM, where we had infected cases, are transitioning with the help of the NZ and OSMED teams to transition whereby CWM will get back to its core function of dealing with non-COVID related illnesses, and only the very, very sick with COVID, those that require respiratory support, ventilatory support, will be managed in an isolated setting. And now FEMAT, the field hospital, is transitioning or has almost transitioned into the center that looks after the COVID patients. I did have a chat with Dr. Chemesa Tundravu yesterday, and Ministry of Health is actually liaising with the divisional officers to set up, or they're increasing the surge capacity. So you may have heard or seen the National Gymnasium and a few other centers where beds are being set up. And I think according to Dr. Tundravu, the capacity of this setup will be almost like 1,000 beds. So they are slowly increasing the numbers, whereby we expect a surge in cases, those that will require sort of beds and monitoring. This temporary field hospital, so as to speak, are being set up to take care of that surge. So that is it. We are in the mitigation phase. It's going to get, the sad thing with this phase is that, and we are already beginning to see, initially more and more people get the virus. It's penetrating to those that are most vulnerable, the elderly, those with comorbidities. And unfortunately, one of the things which is sad, I mean, it's not unique to COVID, but our population has, or significant proportions of the population would seek sort of non-medical treatment or therapy, stay at home, try this, try a bit of that. And when you don't get better, sort of we're really, really sick, then only you present to the hospital. So a combination of these factors is seeing us now see the very, very sick and patients that are actually coming straight up, presenting and needing ICU level care. There have been patients that actually, they don't make it, they die presenting to hospital. So the bad thing with this, increasing numbers is the increasing severe cases and the increasing mortalities we see. Like we said, we have lost colleagues, and yes, the doctors, like, you have to imagine the workforce as well, like doctors, nurses, and other paramedical staff. They have to not only look after, the COVID patients, they have to look after other non-COVID patients as well. They do get fatigued. And the strategy of looking after COVID patients is that when you're looking after for 2 weeks, then you have to go and sort of self-isolate and quarantine, because we are putting ourselves in harm's way. We do get, in spite of all the double vaccination, in spite of wearing full PPE, there are chances that we will get sick with the disease. So if a health worker tests positive, they have to go and isolate. That creates a big human resource crisis. So the other thing that the Ministry of Health probably is finding challenging is workforce management, human resource management. So combination of these factors has led us to go into this mitigation phase. And like I said, all is not lost yet. If each and everyone takes COVID as their responsibility, does the right thing, I believe we can break the chains of transmission, as Dr. Lisi and Dr. Emi have been emphasizing. We have a golden opportunity with the vaccines, which we have available and been given to us by our two big brothers, Australia and New Zealand. Let us, get vaccinated. Once you get 2 doses, 92% chance that you will not get sick from COVID, even if you encounter it, and you will not die. Who would not want those odds? We have got the solution staring at us. It's there. So let us take advantage of it. Let's get vaccinated. And hopefully once we get that threshold of herd immunity, you'll see a rapid drop in the number of cases, rapid drop in the serious cases. But right now it's as bad as it's going to get, and it's probably going to be bad for the next few weeks.
Thank you, Dr. Bashar. And Dr. Emi?
As Dr. Bashar had explained, we've basically moved from population strategies where we did the boundaries, the isolations, the contact tracing, the lockdowns, and the curfew. We've moved from that to more preventative risk communications plus tertiary care. And I think we are actually beefing up the tertiary care level and categorizing the diseases and managing it at that level, just because it's surreal. The situation is surreal now. It's spiraling out of control. And we've just had to reach a stage where the strategies have changed, and as you alluded to, set up centers in and around the place. One of the factors too is because the medical people are getting sick. And when they're getting sick, they have to be isolated, quarantined, treated, and then let alone finding out their primary and secondary contacts. And it's the cycle also of going on shifts 2 weeks off just because you've been in close contact with the COVID patients. It's a lot of factors that have arisen, but the fact that we are moving out into having isolation centers and treatment centers in and around the place is basically the beefing up of our tertiary care. We've moved from population strategies, risk communications, preventions, and now we're at the tertiary care level where we're going to have to manage our critical care. And what we see now is from initially the asymptomatic, mild and moderate diseases, we're getting a rise now in the severe cases. And this is all the more reason why we're driving and pushing for vaccinations, just because 33% on the first dose of vaccination is your protection and efficacy, and 92 to 93% preventing you from hospitalization and getting severe disease if you do get vaccinated. And also to cut down the transmission rate from 50% and 50% in the first vaccination and a lot higher in the second vaccination.
Thank you, Dr. Emmy. Now, going to Dr. Lisi, we talk about vaccinations. There's some people saying that we've never had this level of anti-vaccination ever in Fiji. Before COVID-19 vaccines arrived, even speaking to some of those in the health sector, they were saying, we always have a high vaccination rate. We do not need to really worry. But as the vaccines started coming in, you saw a flurry of comments and negative comments all emerging, mainly on social media and other places. This will also be on social media. So we are right in that area also where people will be watching us who maybe, first of all, why are they not getting vaccinated? People are afraid of needles maybe, afraid of microchips, afraid of death, afraid of mark of the beast. Those are the things that I've been saying, afraid of things that maybe in the vaccine that they do not know. So you as the three doctors, we'll start off with Dr. Lisi. Can you talk to these people who are watching us also in relation to having their doubts or even being afraid to get the vaccine?
Right, okay. So what I said is that a lot of the information that people are getting are just from every Tom, Dick, and Harry. And, people who have no credentials, they don't know. I don't know what all this is about. It's almost. So this is, the advice has always been to the people who are not sure about this thing is to check out the reliable sites. Go to WHO. There's some good sites where they can get the real information. For here in Fiji, the Ministry of Health, WHO. But now there's so much in the world about, they're so suspicious of WHO even, the World Health Organization. Suspicious that there's something, it's uncanny. I have never seen this level of disbelief in the system. And really, I don't know. For me, we just continue to tell them. And they will make up their mind when they see what is happening, or like what the Prime Minister has said last night. I heard last night that no jab, no what? No jab, no job. Something like that. That will force people. I mean, of course, we don't want to go to that level. If people, complying, they come forward and receive the vaccine. But these things that's every day I get, me personally, on one of those Viber or Messenger, some message that is, and I can't, I have to stop it right there. I don't send it to anyone because it's just not on. I have no idea what to do about it, except we keep on talking to people until they know. Like Bashar had said, maybe when it comes down to them, when they feel it personally, when they have an experience with it, then they may change their mind. But right now, all I can say is the vaccines that have come have been thoroughly researched, tested. They test them for the efficacy, for the side effects, and even how long, how much protection they give. So when we're talking about vaccines now, like you heard Amy saying, how much protection they're getting when they have 2 doses of vaccine. We all know what the side effects, nothing is hidden. It's all there for people to know. These are the possible side effects. But this severe side effect happens after giving so many doses, they give the figure. So nothing is hidden. It's not like, we are bringing this in and we're not telling everybody what's what. Everything is there in the open for people to know. So there is a very strong movement nowadays of anti-vaxxers all over the world. So only thing we can do is to keep on, for us in health, we just keep on trying to convince the people that this is what we need. The government is taking another step. So this is what it has come to. I think they are employing the Public Health Act.
Thank you, Dr. Lisi. And Dr. Basharat, you also had a Lotoka doctor come out and make some comments. Of course, it has been branded fake by Facebook, but it raised a lot of concerns amongst the public that a medical doctor was raising this, and also the suspicions grew yet again. As President of Medical Association, your comments on this?
Thank you, Vijay. Yes, it is said that a practicing medical general practitioner unfortunately decided to make a video which was factually inaccurate, and sadly it got picked up by gullible individuals and shared multiple times. And when it was brought to our attention, obviously as the Fiji Medical Association, we had to respond to it by saying that the contents of the video were factually inaccurate. And it's sad. I think when one probably digs into why, as Dr. Lisi has said, why are there so many anti-vaccine movements now? Well, back in the day, we did not have social media. Social media is probably fairly new, probably coming into full force into Fiji, probably from like 2010, 2011. Facebook came into existence, I do believe, in 2006 or somewhere around there. Prior to that, people talked to each other. People, what was available was good, solid information. Social media was meant in its essence to connect loved ones and friends so that they could communicate with each other. This initial intention of creating all these social media platforms very quickly was taken over by an underbelly of sinister, just plain old anarchy. And you saw this, I mean, one doesn't have to look far. We looked at the US elections in 2016 and how the country of Russia was able to utilize social media with so much propaganda and was able to change outcomes of an election. This has happened in other places in the world where people who understand and they know how to work social media, these are people that can create a lot of misinformation, a lot of distrust. And all it takes is to somehow connect with your audience, just raise that little bit of doubt in the minds of those that are listening. And once you plant that seed, and that seed grows, and they propagate that false information to their loved ones, then as we can see, things go viral. So today we are dealing with, sadly, I think social media is great. It can do a lot of good. However, unfortunately, it has its dark side as well. And everyone has a right to free speech. You have a right to believe what you want to believe. But at the end of the day, when we are faced with a problem such as COVID-19, and it affects like not only an individual or groups of individuals, it affects the whole the nation as a whole. Not only that, it affects the world as a whole. It becomes the collective responsibility of everyone actually now to do the right thing, take the right steps, because the decision you make not only affects you as an individual, it'll affect your immediate family, and it'll affect your community around you, and indeed your nation as well. So I think I'd just like to sort of go back to the basics about vaccination. I mean, like I said, there are not only that particular doctor, but there are other people that are constantly, trashing vaccination with basically baseless arguments. Just like to go back and explain to people who are listening that the vaccine, this is nothing new. We've had vaccination for many, many years. Dr. Lisi back in 1970s when she started was vaccinating children, etc. So the concept is nothing new. When we had this COVID-19 disease, which is highly infectious, highly deadly, the whole, medical community, the scientists, all the pharmaceutical companies, everyone banded together to find a solution. And normally it takes a long time, mainly because of checks and balances and a lot of red tape to roll out a vaccine. Every year you get new flu vaccines, so this is nothing new. But the whole world worked together really, really hard to quickly develop a vaccine that is safe, that is effective, and it was rolled out in record time. So it was unprecedented, and rightfully people will ask, ooh, why so fast? Is it safe, etc. But I can reassure you, like, there are phases of trials that the vaccine goes through, and before it'll be rolled out to the public, it's made sure that it is safe, it is effective, that the side effect profile is very low, and then only it will be given. So our AstraZeneca vaccine, which was developed in Oxford University initially, more than, I would say, like more than 50, 60 million Europeans have had it, and other places in the world. So it's tested, trial, side effect profile is low. Yes, it does have a serious clotting side effect, but it is in a very, very small percentage of people that get it. If you recognize it early, yes, you can treat it as well. So let's just say that, re-emphasize that the vaccine, it's technology that is nothing new. It was developed in record time. It uses, so people sometimes say, what's in the vaccine? So just let me put it in very simple terms. What is in the AstraZeneca vaccine is a transportation virus, adenovirus, which contains, which encloses the genetic material for the DNA material for the SARS-CoV-2 virus. So once inoculated, and there are other constituents in the vaccine, like a bit of mineral, a bit of salt, a bit of fluid to sort of keep it stable. So once it's inoculated in the body, your immune system doesn't destroy it very quickly, because this adenovirus, it's a new one that the human body has not encountered. It takes a bit of time for your immune system to recognize before obviously discarding it. By then, it has done its job. It's delivered the genetic material into cells. So the cells in our body now produce antibodies against the COVID virus. So once it's done its job, in the future, if you encounter the COVID virus, coronavirus, you already have the antibodies against it. So your body can very quickly fight it off. Most people won't even get an illness. And if you do get a bit of an illness, it won't be too serious. So the contents of the vaccines are, as I explained, are nothing to do with any propaganda. It is all based in science. It is designed for your body to actually produce an immune response that'll help you not get sick when you encounter the real thing. So I hope for people who are listening to this discussion with my reputed colleagues, Dr. Lisi and Dr. Emi, take heed of what we are saying. I personally have had 2 doses of the AstraZeneca vaccine. I did not get any side effects, thankfully, from both the first or the second dose. I was just working my way through it. And a lot of people I know have had the same thing. Some people might get a bit of side effect, a bit of flu-like symptoms. They get better. I've talked to Ministry of Health officials. There is a reporting system whereby any adverse effects of the vaccines are reported. So yes, there have been some sort of minor side effects due to the vaccine, flu-like illnesses, etc. But to date, no one has had any serious consequence of the vaccine in Fiji, and no one has died. So it is, and like we say, we've given to over 300 plus thousand people. So it is safe. A lot of people have gotten it. It is our best chance, best strategy that we have to overcome this illness that we are facing. Because all the other measures, they require compliance from the public. As we have discussed, not everyone is very compliant. However, if you get vaccinated, you still need to be compliant with all COVID-safe measures, but it gives you that extra bit of protection that is more controllable.
Thank you, Dr. Bashar. Dr. Emi, you've gone out with a video debunking some of those things about magnets and microchips, and definitely going into that space where the misinformation and disinformation exists. What's your message to the people watching or listening to this?
I actually give a message. Before I actually give a message, VJ, we have to understand that just thought of a vaccine, introducing a vaccine and whatever's in the vaccine into people will create some sort of a fear, and it's all these anti-vaccine and all these conspiracy theories and hoaxes. They come out of misinformation plus ignorance, which is the biggest thing. And to effectively get the message out there about vaccine, you've got to give clear messages. You got to contextualize the vaccine. You got to talk about what's the science behind it, what's the logic of basically getting it done. It's in their ignorance they will refuse it. It'll be a fearful thing, so they will resort to all kinds of media outlets that will tell them more about the vaccine, and they actually do not go to the sites that are reputable and have actually proven that the vaccines are potent and effective. So it's the messaging, how you basically get the message out there so that it's clear and it's in a context that the layman will understand. Then they will appreciate it. You give them the evidence, you give them the scientific basis of it, then they will understand it. That's why I went and did that video. I did it in a way, I know it was going to provoke a whole lot of discussion. I was literally murdered, I know, and the resistance was just quite great. But then you get to see how people actually think and what's their view on what is the vaccine. What is the vaccine? So in terms of giving the vaccine to the people, they must understand first that we're dealing with a virus that actually belongs to the animal kingdom. Belongs to the bats. And the bats actually have an immune system. Your immune system is your defense system. It's the soldiers of your body, and the strength of the soldiers of your body will be actually exhibited when you actually have an infection. So the bats have the immune response to that particular virus, COVID, and they were able to take it down. Whereas humans, we do not have it. So when we get the virus, it overwhelms our soldiers, the soldiers of our body, and when we basically start reacting to take over the war and fight that virus, it produces mass warfare, which is the inflammation, and that is the problem that creates complications and it becomes fatal. We basically die. Okay, so why the vaccine? Because the virus, the COVID virus that is basically gotten infiltrate our body and create damage, needs to have especially soldiers to be basically produced by the body to take it down, to recognize it. So when you are actually vaccinating, you're giving a part of the protein of the virus. Okay, the AstraZeneca has the DNA protein, DNA of the spike of the virus, and that footprint is what is recognized by the body. Then they create their specialized soldiers to take it down, to fight it. They create the soldiers just like the soldiers that are in the bats that we do not have. So, you know, just like the U.S. Army has the Marines, the Israel Army has the Mossad, we create our specialist soldiers that have memory of that particular virus, whereas it's actually the memory from the protein of the virus, not necessarily the live virus. So it cannot cause COVID in the person. You cannot get the infectious COVID in the person because it's just a protein that's been injected in the person. You get your specialized soldiers to begin to take down that protein, build up memory cells so that when the virus basically comes in to infect the person, you have the memory cells and you have the specialized forces to go in and take that down. So without the vaccine, you basically do not have any immunity to the virus. And that's why it can create damage and severe diseases in the individuals. So, you know, we have to give clear messages, give the people the sciences behind it, enlighten them on what is the whole process in terms of the body plus the vaccine. And it's not that we're giving just anything to build up their protection. We are boosting their immune system so that they can stand against this actual virus infiltrating and invading their bodies. I think it's the clear messages, because it would be interesting to basically do a survey and find out why people do not want to vaccinate. And most of them, it's because of the stories they've heard, the sites they've visited, the fear of, as you said, needles, the fear of things being introduced into their body. And, you know, like for them, it's like, why should I do it? Why should I? I'm okay, I'm well. But they don't realize they're not immune. Their soldiers are not ready to take down this particular enemy. So to wake up the soldiers, arm them, give them the artillery to take down this virus, we've got to give them vaccines. So it sets off the cascade to build up the person's immunity and ability to fight infection.
Thank you, Dr. Emmy. And of course, I'm sure people are enjoying watching this breakdown of information in relation to vaccine and why you need to take the vaccine so that you can get protected, another layer of protection for you, which is needed. And as you know that all cases, severe cases, the people who have arrived dead at the hospital or unfortunately in very severe condition that they could not be saved, none of them were fully vaccinated. And that's the answer, that you need to ensure do not get information from false or fake news sites which are coming up with conspiracy theories. Get factual information. Now, if we do not get vaccinated or we do not get that herd immunity, of course, Central Division, red zone, a worrying concern. We've got makeshift centers set up. Beds are being put in halls. They are being set up as COVID care facilities. A dire situation. What is going to happen if the number of deaths increase? And the health ministry has said that the number of deaths will increase and people are not able to get to the hospital, and deaths start occurring at home, the worst case scenario. Dr. Bashar.
Thank you, Vijay. And I think we have seen these examples in other countries, actually. Don't have to look far. This happened even like a first world country such as the United States of America. Its health system was overwhelmed. There were just too many deaths where, you know, they had a crisis of even dealing with those that had died, let alone those that were really, really sick. So you get to a point where your healthcare system is just saturated. Maybe your health workforce is just overwhelmed. And just to put it shortly, it'll be a catastrophe, not only a health disaster, but a socio-economic disaster for our nation. I think one way to sort of look into the context of this is if we did nothing, and these are some simple mathematical models that have done the predictions. At its worst, the outbreaks in the US, at its worst, like doing pretty much nothing to mitigate or to stop the virus, you can expect to see around 800 cases a day, 800 cases per million population a day. And, we don't have to look far. We are almost hitting those numbers. And so everything that we do is designed to make sure that this peak either never happens, or if we are reaching this peak, we can flatten this very, very quickly. Because, if there's a family of 4 or 5, all of them get sick, 2 of them die, who's going to take them to hospital? You'll have a crisis at home. We don't want to get this point. Just if I can go back to the discussion regarding vaccine, I saw a very interesting information this morning. So there was a family of 6 people, family of 6, and the head of the family is a healthcare worker. He noticed that his relatives were a bit sick, so he organized for a COVID test for all of them. So 6 of them got swabbed. And out of the 6, 5 were positive for COVID-19 and 1 was negative. And the factor that differentiated this 1 negative person and the 5 positive was that this 1 negative person had been fully vaccinated. So very clear example there of how effective the vaccine is. And not only this, I think during the Sydney outbreak, there was a party in which 30 people sort of were involved and 24 of them got the disease, 6 did not. And guess what? The factor that protected these 6 were vaccinated. So let us not even think about that scenario where we'll have a social catastrophe. We hope we don't get there. We do not want to get there. Let us do things we know works, which is vaccination. I would encourage everyone to get vaccinated.
Dr. Amy?
Vijay, could I just jump in there? And the fact that we are to get vaccinated, get an 80% coverage so that we have acquired our herd immunity, it's also to protect the vulnerable and protect the children. They don't have vaccines for them right now. I mean, AstraZeneca, we cannot give it to them. So it's the vulnerable, the children. And then when we stop with vaccinations, you literally stopping, reducing transmission. So when we've all been vaccinated, there's no way the bug can move, and we stop its transmission at that point in time, and we are protecting everybody besides the vulnerable and the children. So that's the whole reason why we must try and achieve herd immunity and get everyone vaccinated, especially the adult population.
Dr. Amy, I was coming to you. What do you see happening in next 3 months in Fiji? If things do not change quickly, people do not get vaccinated, there's hope there now with that vaccination issue for workplaces. But you also brought up the issue about children. A lot of parents are concerned about children as well. School has not opened, and it won't open anytime soon. With these things at play in the next 3 months, if things do not change, what do we see happening as far as deaths are concerned? We're already in the red zone in the Central Division, and children unable to get vaccinated. What do we see happening?
Okay, in terms of children being protected from COVID, that's the answer, is herd immunity amongst the adult population. And in terms of three months down the road, the way it's spreading and everyone is getting vaccinated, either 1 or 2 doses, the people that actually will get the disease, they'll build up immunity themselves. So we'll peak. What we're doing is we're watching it to get into the peak point. It's at the peak point where we plateau. It's when we have the people that have been infected, that have built up their immunity, or those that have been fatalities and have passed on. And then we have achieved our herd immunity. We should actually arrest it at that stage. Once we plateau, we start going down. That's when we arrest the transmission of the virus and the ability for it to create more fatalities. So 3 months down the road, it's either we peak, plateau, and we have an immunity because those that have gotten ill have built up their own immunity, and those that have caught up in terms of vaccination have built up immunity. The bug does not transmit anywhere else. But then with it, with such an escalating level of positivity, I mean, the rate, we've doubled the WHO accepted range. It's escalating, it's surreal. So at the rate that we're going, we'll either achieve it with those that are getting infected, have a fatality rate, and those that are getting vaccinated. So when we come to that balance, we basically stop the transmission and stop its infectivity altogether. But it's going to cost us. It's going to cost us. Fatalities are going to be high.
That's a concern, Dr. Lisi. What do you see happening in 3 months as Dr. Emi and Dr. Bashar have raised that we may have a lot more deaths as we reach there if people do not comply and do not get vaccinated?
That is true. I agree. I totally agree with what they have said, Amy and Bash. And the answer, we're talking about herd immunity. Many people are, let me just, I just want to tell the people, please don't wait around for the herd immunity. The children need the adults to be vaccinated so then they can be protected. Children make up about 40% of the population of this nation. The people who are not getting vaccinated because the vaccine, this vaccine is not tested for them. It's not safe yet. They are doing that in other places, trying to do research for amongst children, see what is safe. So there's a big percentage of children in Fiji. Therefore, the adults really need to step up. And we have to appeal to all adults in this nation to come forward and be vaccinated. Please, if we love our children, we want the schools to open, let's get vaccinated to protect our children, school children and the kids at home. That's all I'm going to say now on this subject. Thank you, Vijay.
Thank you. My final question for the three doctors. I'll start off with Dr. Emi. It's in relation to human resource capacity distribution, mainly for medical workers. Where do we sit at the moment based on increasing cases? Of course, an analysis is always carried out by those in the field as far as capacity is concerned. What do we need to do as a nation? What do we need to do to ensure that we assist each other, and including our medical frontliners, where we can see that, as we've said earlier, that things are really getting stretched. Dr. Emi first.
Okay, our human resource capacity had been basically short before the pandemic. And reasons being there were retirees and mass migration of skilled people in terms of medical, in terms of doctors and the nurses. So we were pretty just hanging in there in terms of our human resource capacity. And when this COVID came in and it set in, we started. We were just sparsely distributed and managed, fit into our different areas of operations. And then the staff started getting sick. Those that got ill and those that had primary contacts. And then we had the protocols of where they had to take 2 weeks off if they were in the front line of contacting COVID. And this is when, when we saw the imbalance in rostering and resourcing stations and stations and clinics to handle the load and handle what we're faced with in terms of the surge populations of cases that were coming in. So as far as human resourcing this whole medical frontline, we are struggling. It's a reality. We are struggling. And the other reality too is we are getting sick, and then we need to be protected ourselves, and we need help. And so what we could literally do now is do quick refreshers and upskilling of the junior staffs or the trainees or even senior medical students. We upskill them and train them in the easiest, safest, fastest way, so that they could come alongside us and do the work and actually handle the complications of the disease itself in terms of clinical setting. Now we have to now revamp our tertiary care capacity and its human resource. We're at that level right now. We've gone past the population strategy on going out to contact tracing and all that. We're unable to handle that anymore. Now it's just getting in whatever resources we've got and upskilling them, getting them into skilled areas to help in terms of in terms of carrying out the whole operation of maintaining and mitigating this COVID at tertiary care level. And for whoever's still trained, just don't stop it. Continue. Beef them up and pull up the ones that are near fully qualified, just to help alongside, because we're losing the experience, the senior staff. We have the expertise, but not enough of it. We have the expertise, but not enough of it. We're stretched to the limit in terms of human resource. So we just have to look at means of getting these ones quickly upskilled to come alongside to actually help out.
Dr. Lisi?
Yes, I agree with what Amy has said. I've been harping on this, that our health workers have really been worked off their feet. And for me, I'm just appealing to the people to get vaccinated, please. Because as Amy said, now we've got very sick people that need to be in intensive care, adults and children also. So that is really, you can't, if you have a sick person in ICU, sick child, that's a lot of work, constantly looking at that child. And if you have many, that's it. So nurses are busy vaccinating the public health people. Hospital is now concentrating on ICU. There are more people coming in sick. All I'm saying is we cannot sustain this if people are not vaccinated and more people come in sick. There will be more people in health. Some may even die, like we've already lost one. And that is not something that we want to see. So because I don't work anymore, I just want to appeal to the people of Fiji. Just get vaccinated. For the children's sake, and for all your health staff, the frontliners, they cannot continue to do this. Something is going to give. Something's got to give. And we don't want to see that. So please step up and get vaccinated.
Naka Dr. Lisi, Dr. Bashar?
Vinaka Vijay, I totally agree with Dr. Amy and Dr. Lisi. One of the things I think we haven't even mentioned at all is that we still have an NCD crisis in the country. We know those people suffering from those heart attacks, strokes, diabetic sepsis, and all of that. They haven't gone away. COVID has just come and taken over. So now COVID patients are competing for those beds. They're competing for the human resources. They're competing for the limited, medical resources that we have. So, our system already was, under pressure from the complications of NCDs. And now with COVID, it's like a double whammy, so as to speak. And I agree, something's gonna give something. it's not a sustainable system. So I also would like to appeal to the Fijian public, please, the health workforce cannot do this alone. This is a disease that's really, really infectious, but it is preventable. Listen to the good advice. We've talked about this now, I guess, for 90 minutes. And you would have heard us saying the same things over and over again. If we can prevent it, our health system won't get overwhelmed. Our doctors can go back, to having some semblance of godly hours. Again, they can be safe as well. And we've said this over and over again. It takes simple measures, stay at home if you don't have to go out, only go out for essential reasons. As soon as you step out of your house, wear a mask, double mask now is being recommended. Physically distance yourself by at least 2 meters. For ease of contact tracing, have your Care Fiji app switched on. Please be vaccinated. If you decide not to get vaccinated, sadly, the only person or people that you are going to hurt is actually yourself and your loved ones. They are the first. If you get the disease and you have a bad outcome, your loved ones will suffer because you won't be there anymore. You may pass it on to your elderly mom or dad or grandparents, and they will have a bad outcome. So in a way, you making a choice which is probably ill-informed, made in fear or for whatever reason, an ill-informed choice not to get vaccinated, you'll actually harm only yourself and your loved ones and probably the community around you. So please listen to good advice. Do this for us. We, on behalf of the Fiji Medical Association, all the doctors in Fiji, all the healthcare workers, please be a hero, be a responsible citizen, be a patriotic citizen. Do what John Ferdinand Kennedy said. Do this for your country. Please get vaccinated. Please practice COVID safe behavior. Let's beat it together. And on the other hand, we will come out stronger and more united as a country.
Amen. Thank you.
Vinaka Fiji, on this Friday night, let's beat it together. If you're still not vaccinated, vaccination centers are open every day in different places, and it's been clearly stated that you can go to any of the site to get vaccinated. It's no longer being done in bubbles. You can go to any of the sites to get vaccinated. Drive-through vaccination centers are also open. Albert Park at FNU campus in Nasinu. There's another one being set up in Ba, most likely to open tomorrow. So please go out, get vaccinated. The three doctors, thank you so much for taking out your valuable time. I'm sure that people have really got the information that you have shared in relation to vaccination, in relation to how the Delta variant is so dangerous, and really breaking it down on why it is so important also to help our health workers who are going through trying times at the moment. And we'd again like to shout out to the frontliners, keep it going, and we'll make sure that Fiji is behind you. Good night.